Good afternoon, guys. I hope we're all sparkly. A shout out to Ron and his wife from America. Much love. Stay sparkly. What should we talk about today? Let's talk about mental health, because I like a little bit of mental health. Hopefully you guys realise that I'm very passionate about affecting a positive change to you, to your physiology, so you can improve your psychology. I can't improve your psychology. You've got to do that. However, do not underemphasize the importance of normalizing your physiology to improve your psychology. So when you present with low testosterone, you often have an element of low mood, anxiety, and depersonalization. What the hell does that mean? Well, this year has been a pretty crazy year. Lots of stresses and strains imposed on us. And we've probably imposed some stupid stresses and strains on ourselves by not realizing this is a journey, and whatever struggles and challenges you face, you must see them as opportunities. And low testosterone robs you of that. You scan the horizon for threats, not opportunities. You wake up in the morning, am I anxious today? Well, I am now. It's horrible. Now, I know this because my levels went up during lockdown through lack of activity. My dose was subsequently reduced. My activity levels went back up, lots of HIIT, less hardcore heavy weights, but my levels dropped. And the sensation of low testosterone returned. Seeing negativity in everything, seeing threat in everything, trying to maintain a positive outlook, but deep down knowing that something was wrong. Not realizing my levels had dropped because I'd increased my activity. So on the face of it, smiling, happy, but deep down, worried, constantly under threat. Bad. So my dose has been increased. And do you know what? I feel sparkly. So do not underemphasize the importance of looking at your physiology to improve your psychology. Because as much as it's good to talk, talking with dysregulation of your hormones ain't gonna do anything. Whether that be your melandrin levels or you've got hypothyroidism, if you've got a physiological dysregulation, all the talking in the world isn't gonna correct that. You can rationalize, you can empathize, you can sympathize, you can contextualize. But if you've got a physiological problem, it has pretty much fuck all chance of working. So we're told to talk, we're told to express our emotions, but if you've got a physical problem, you're wasting your time. So look after your lifestyle, reduce stress, improve sleep quality, eat proper food, engage in regular physical exercise, test your hormones, and then look to other things. Because consciousness is the appreciation of subjective, subtle changes in your physiology. And if your physiology is kaput, it's going to struggle. Now, we always think about teenagers being randy goat boys. High testosterone, high dopamine, On the face of it, sounds wonderful. But why do they engage in risky behaviors? It's because they're trying to elicit a change. And that risky behavior has to be dramatic in order to elicit a change in physiology. With low testosterone, it's exactly the same. But you see negativity when there's positivity, threat when there's potential opportunity. So it's just affecting that paradigm shift in your consciousness and thinking that will be the result. Happiness. Work on it every single day, because every single day it's a new opportunity to go kick some ass. I was chatting to one of my guys the other day, and this is the topic we were talking about: affecting a positive change, because 3/4 of all suicides are men. And the false assumption that it's just because we're not very good at communicating. Now, women are very good at communicating, aren't they? Just holy crap. No, I'm serious. they have much more compassion and empathy. They would make very good leaders, but to be a good leader, you need a little bit of psychoticness. So what am I talking about? Disrupted as usual. Women versus men. Or let's not go there. What was I talking about? Yeah, I was chatting to my patient friend, and we were talking about the fact that talking therapies are not going to be effective if you have a physical problem. Now, when we think about anxiety, why am I anxious? Why am I anxious? And I'm sure it's dysregulation of your physiology. That's not to say that childhood trauma, life events cannot beat you down to a pulp, but it's the physiological impact of that that is causing your anxiety. So we should always look to symptom resolution, problem solving to prevent this from happening. But what actually happens when it's happening? So let's go back to the autonomic nervous system, fight or flight. When you're anxious about a situation, you have sympathetic overdrive. You're either going to fight or you're going to flight. So we want to use that physiology appropriately, solve that problem so that we can go into parasympathetic, rest, relaxation. But we struggle because we're not sure how to resolve the problem. So talking, working through your problems will help that. But you need normal physiology to do that. So sympathetic is the nervous system. Cortisol's the hormone that is the stress hormone that then releases glucose, which you're supposed to be physically active with to utilize to fight or flight. But because our stress is predominantly psychological, we have an excess of glucose that causes an insulin dump and eventually insulin resistance, which then causes an increase in adiposity and possibly a fatty liver, which causes excess aromatization and excess estrogen, which feeds back to the brain to tell the brain that you don't need to send signals down to the testicles. And so you become hypogonadal through psychological stress. That anxiety, unresolved anxiety, is going to cause you to become hypogonadal. How crazy is that? A psychological stress causes a physiological problem. Mental, isn't it? Absolutely crazy. So if we understood our physiology and we worked with our physiology, and the autonomic nervous system is the key. You have sympathetic, fight or flight, you can't escape that. But you also have parasympathetic, rest, relaxation, social engagement. So how do you become parasympathetic? Solve the problem? If that is overwhelming, let's try and work this out. It's an autonomic, as in automatic system, but there are two things that you can do to manipulate your autonomic nervous system to become parasympathetic. What do most people do? Well, they eat, don't they? It's called comfort eating. They are gaining comfort from the psychological stress, which is simply your physiology. Food, dopamine, nice. And the cycle continues and you become a chunky monkey. And it doesn't actually solve the stress, does it? It just compounds it, because essentially you become unhealthy and you actually manifest as a physiological problem. That psychological stress is now physiological. Boom, you're in trouble. But what can you do that is super positive? Breath work. You can manipulate your vagal nerve through breath work. Have you ever wondered why somebody who smokes goes outside for a cigarette to relax? Now, the nicotine's a stimulant, isn't it? It's a bit retarded. But it's not that. Kind of makes sense, doesn't it? So, if you understood physiology, you could positively impact psychology. We should be having a blast. We should be productive. We should be enjoying life. Not too much, because too much reward, which has been taken rather than earned, will ultimately leave you dissatisfied. It's like when we talk about anabolic steroids. 12 weeks where you can potentially, not always, feel wonderful. And then you go back to normality. Well, you have to either do post-cycle therapy or recover naturally and have a dip and feel terrible. But because you've distorted your physiology through anabolic steroids, and it's been a long time, 12 weeks, getting back to normality is hard work. Because what the hell is normal when you've had 12 weeks of being Superman? So why not just be Superman? Because obviously it has a catastrophic effect on your physiology. Now, irrespective of it, whether it just being superhuman testosterone levels, we already know that they cause deleterious effects on hematocrit, blood pressure, lipid profile, bangers, all sorts of things. We don't want that. But anabolic steroids like DHT derivatives obviously create less estradiol because they feed back to the hypothalamus and pituitary, so you no longer send signals down to the testicles to produce testosterone. And if the derivative is pure DHT, you will have low estrogen. And we don't want low estrogen. We want a healthy estrogen, don't we? For mood, cardiovascular health, fertility, bone strength, all sorts of things. So you might feel superhuman, but with any drug that distorts your physiology, you are going to have to pay the piper. You might get away with it once, you might get away with it twice, but it's a risk. Risk versus reward. Through education, we can affect a positive change. Through education, ultimately, the decisions that you take as an autonomous individual are yours to take. Now, it's up to you, but the help will always be there.